Hey everyone, it's Dr. Groff from San Diego, California, and I'm here with my patient Lola. Lola is 58, and we're going to do my favorite procedure on her today, which is laser resurfacing. We always use a combination of lasers to get the best result. So for her, we're going to use the Vbeam Perfecta laser to address broken capillaries. Next, we're going to use what's called a QSwitched Alexandria laser to ensure the brown spots are gone. And then lastly, we're going to use what's called the Lumenis Ultrapulse Encore CO2 laser, and then we're going to use the Sciton Erbium laser so we can get rid of all the lines and wrinkles, or as much as we can. If you go to look at my before and after pictures, you can go to Facebook and just type in my name, Dr. William Groff, or Instagram, same thing. You're going to see that we can easily take 15 to even 20 years off some of our patients doing this approach. Now, one thing I want to point out is that if you use a fractional laser to resurface a patient, you cannot get nearly the results. And all you have to do is go online and look at the difference in the photos when we use this combination versus someone who just uses a fractional laser. This is laser number one for our transformation. We're going to use the Vbeam Perfecta to address broken capillaries in the nose, cheek, chin area. And this is the Vbeam right here. So we'll get started now. Sometimes I look for that. Another important thing is to make sure that you treat the ear. I always treat a patient's ears because it doesn't make sense to have this beautiful skin here and then have the sun-damaged ears. And many doctors don't treat the ears, which I can't quite figure out why they would skip this important part. Now we're going to go to laser number two, which is the QSwitched Alexandrite laser. One of my favorites. It's the best laser there is for individual sunspots. So you can see she has a lot of brown spots, and when we do the Alexandrite, you'll see each spot will get a light frost to it. So we'll get some live footage of that. And you can see right here, this is the QSwitched Alexandrite laser, which is the workhorse for sunspots in our practice. We're in our laser suite and we're ready to do the main part of our procedure, which is the laser resurfacing part. So I'm going to be using this laser, which is the Lumenis Ultrapulse Encore, which does the majority of the work. So I'm peeling the epidermis right now, which will enable me to go a little bit deeper and get the best result possible in the lines and wrinkles. You can see the patient's perfectly comfortable. During the 18 years I've been performing laser resurfacing procedures, I've found that the best way to make a patient comfortable is to use a combination of topical anesthesia, nerve blocks using Novocaine, but most importantly, IV sedation, like a twilight sedation, where we use medication via IV to relax a patient, keep them very comfortable. So I just did some work with the CO2 laser. Now I'm going to use the Sciton Erbium. This is my sculpting tool, so I sculpt away the remaining lines. There's already a big difference. Tightening as the laser pulse. So this laser here is the best skin tightening laser or device in the market, period. So you can see that with that instant tightening effect on the upper eyelid. That's pretty good. almost done. We're going to do a final pass on her lips, because the lips, just like the rest of our skin, gets sun damaged, wrinkled, precancerous spots. So the beauty of this procedure, not only do you get an incredible cosmetic result, but it removes all the precancers from your skin as well. So. Hopefully not quite. So we just finished our full face laser resurfacing. Patient did amazing. You can see during the procedure there was very little discomfort. We do everything we can to make our patients comfortable. She's just washing out her eyes because we did have a protective eye lens in there to help protect the eye from the laser. So we will follow up with her tomorrow, and we'll see how she's doing.